Mga posibleng tanong na maaring lumabas ngayong darating na board exam ang alay ko sa inyo for today. 15 board exam type of questions with rationalization that will cover your fundamentals of nursing. If you want to know more about that, stay tuned.
Hi everybody! Welcome back sa ating channel. Yes, maraming salamat nga po sa patuloy na pagsuporta nyo at malapit na nating mahit ang ating target 10,000 subscribers. Currently, meron nasa 9K na tayo. maraming salamat po for making that happen and gusto ko lang humingi ng paumanhin sa hindi ko pag-upload ng videos lately. Pasensya na, medyo busy lang. But I just want you to know that you guys have been reading all of your comments on my videos and I really appreciate all your love and support. Kaya naman, nagbabalik ako for another nursing test banking video. Ngayon, kung hindi mo pa napapanood yung other nursing test banking videos na create ko, naku, marami na yon. Ililink ko yung playlist sa description box or kapag nagpapaut itong icon button dito sa gilid na to somewhere, click that one out kasi ililink ko siya dyan kasama ng ibang mga playlist natin sa nursing education. Kagaya ng sinabi ko sa intro, I'm gonna give you 15 nursing board exam type of questions that will cover your fundamentals of nursing. Mga common questions ito, nurses, na lalabas ngayong posibleng lumabas ngayong darating na board exam. Now, medyo mahaba nga po itong video na to, kaya naman hindi ko na patatagalin pa. In order for me to do that, let me switch back to my PC and I'll see you guys in a bit.
Hi everyone! Welcome back sa ating formal discussion ng iyong Foundation of Professional Nursing Practice, PNLE 1 Nursing Test Banking. Yes, ito nga ay panibagong entry natin sa ating Nursing Test Banking kung saan nag-iipon tayo ng mga tanong na maaaring lumabas sa mga board exams, sa NCLEX, sa CBT, sa OSCE, sa AHAD, sa DHA, PROMETRIC, at kung saan saang exam pa. Let this be your nursing study guide sa pag-aaral mo, sa paghahanda mo ng test na darating sa buhay mo as a nurse. Buhay mo as a nurse, yon. Yes, na ngayon yon. Punta ako nagmamadali. Ngayon, kung hindi mo pa napapanood yung iba nating nursing test banking na talaga namang sobrang init ng pagtanggap nyo, panoorin mo siya. Ilalagay ko yung actual playlist sa description box or simply click the icon button kapag nag-pop out. Iyon, hindi ko alam kung bakit ako nagbabuckle today, but I'll try to speak clearly just so everyone can understand. Handa ka na ba? O, wag na tayo magpatumpik-tumpik pa. Ilaban na natin to. Let me share to you our objectives. We only have 2 objectives every time that we do our nursing test banking, huh? This is our intention. 1, I'm going to provide you and discuss to you board exam type of questions. 2, I'm going to provide rationalization per each board exam type of questions. Now, ang scope nga nitong ating video is the following: foundation of nursing practice, nursing research, professional adjustments, leadership, and management. Pag sinabi kong scope, ito yung mga tanong na maaari mong ma-encounter sa video na ito around those 4 coverage or categories of nursing study. Ngayon, if there's anything that I want you to take out from this video, that is the rationalization. It doesn't matter. It doesn't matter how low or how high your score is. The one thing that is the single most important thing at this very moment as you're listening to me right now is for you to have a full grasp of the rationalization, because sa mga board exam na uulit ang mga tanong, sa mga exam na yan nauulit ang mga tanong, nare-recycle, naiiba ang forma, but as long as you know the rationalization, the reason behind that is the correct answer, kahit pagbalik-balik ta rin ka, you will know exactly where to find the answer. You know that is the answer for that question. Malino ba yon? Malino yon. Kaya naman, pero I still want you to put your scores sa pagkatapos ng video na to. Pag tinake mo exam, I still want you to put your scores sa baba para man ma-evaluate ko yung mga estudyante ko, okay? No shame, no shame. It's a free space here on YouTube where you don't get to be judged. You're just gonna be accepted by who you are. Wow, okay. Now, let me provide you the instructions for our today's examination. So you will be given 15 board exam type of questions. I'll be reading the questions and the choices for you. You have 5 seconds to answer each questions. The answer is revealed instantly after each questions with rationalization. Choose the letter of the correct answer. Good luck, nurses. Yes, if you wanna, I want you to take this exam as if you are taking the actual board exam. Okay? Let's begin. Now, wala akong actual clock ngayon sa akin ha kasi yung phone ko super na drain. I'm just gonna be counting by my hands as 1 to 5 seconds. Kung medyo mabilis yung 1 to 5 seconds ko, i-pause mo na lang. Okay, baby? And then go back. Don't cheat. Alright, let's proceed. First up, first question of the day. A hospitalized client with severe necrotizing ulcer of the lower leg is scheduled for an amputation. Let me change my cursor here. Scheduled for what? Amputation. That is your situation. The client tells the nurse that he will not sign the consent form and he does not want any surgery or treatment because of the religious beliefs about reincarnation. What is the role of the nurse or the registered nurse? Tinatanong ka, sa mga pagkakataong ang pasyente mo ay ayaw mag-sign ng pre-op consent before surgery. Pre-op consent before surgery. Redundant, pero yun na yun. Pre-op consent. Ano ang gagawin mo as a nurse? What is your role? Is it A, call a family meeting? Is it B, discuss the religious beliefs with the physician? Is it C, encourage the client to have the surgery? Is it D, inform the client of other options? All right. Your 5 seconds starts now. Time's up, nurses. Siguro sobra-sobra na yung 5 seconds doon, no? So, ito na nga tayo, mga me. The answer to this question is no other than letter B. Discuss the religious beliefs with the physician. Why? The physician may not be aware of the role that religious beliefs play in making a decision about surgery. Now, kapag hindi talaga umubra yung power mo as a nurse, yung pagtapos may explain yung about sa procedure, mga expected outcomes mo sa pasyente, kung ano yung dapat niya expect, including the preparation and stuff, call the physician, inform the physician, and the physician should be the one to actually encourage or talk to the patient, okay? Especially if it's really needed for the patient, if it's medically necessary, you might want to raise this concern to the physician. Okay? All right. So, board exam type of question number 2. While in the hospital lobby, the RN overhears the 3 staff discussing the health condition of her client. What would be the appropriate nursing action for the RN to take? Chichismisan daw yung mga nurse sa lobby. Oh. Anong gagawin mo? What is your what is the most appropriate nursing action that you will do? Is it A, tell them it is not appropriate to discuss the condition of the client? Is it B, ignore them because it is their right to discuss anything they want to? Wow, ang galing. Chapukin kita. Is it C, join in the conversation, giving them supportive input about the case of the client? Alam mo yung nakakatawa sa choices na to? Giving them supportive input. Taray! Sinuportahan ng katsismusahan ng kapitbahay. Is it D, report this incident to the nursing supervisor? Ang galing. Ito yung mga tinatawag na chip-chip. Charing! Okay. Your 5 seconds starts now. Time's up, nurses. The answer is letter A. Tell them it is not appropriate to discuss the condition of the client. The behavior should be stopped. The first step is to remind the staff that confidentiality may be violated. Period. Next, board exam type of question number 3. A staff nurse has had a serious issue with her colleague. In this situation, it is best to, kapag daw nagkakaroon ng conflict between colleagues, ano ang best thing to do? What is the best thing to do in this type of situation? Is it A, discuss this with the supervisor? Is it B, Not discuss the issue with anyone. It will probably resolve itself. Taray, time heal all wounds. Ganon ang motto mo sa buhay kapag ang sagot mo ay letter B. Is it C? Try to discuss with a colleague about the issue and resolve it when both are calmer. Oh, not calmer, silent L. Is it D? Tell other members of the network what the team member did. Ini-spread the news. Nanggigigil ako sa'yo. Your 5 seconds starts now. Alright, time's up, nurses. What is your answer? Very good. Letter C. Try to discuss with the colleague about the issue and resolve it when both are calmer. Kasi nga, di ba dapat tinatry nyo munang i-work out. Wala naman sa sitwasyon na sinabing na workout na ninyo, hindi pa. So try to talk to each other first. Ngayon, kapag hindi talaga na-solve, erase nyo na ito sa supervisor. And then, alam mo yung channeling, proper channeling, ayun yun. Waiting for emotions to dissipate and sitting down with a colleague is the first rule to conflict or of conflict resolution. All right, let's proceed. Board exam type of question number 4. The nurse is caring to a client who's just had birth to a healthy baby boy. The nurse may not disclose confidential information when. Kailan ka daw hindi magdadisclose na information sa pasyente mong who just had gave birth to a healthy baby boy. All right. Is it A? The nurse discusses the condition of the client in a clinical conference with other nurses. Is it B? The client asks the nurse to discuss her condition with the family. Is it C? The father of a woman who just delivered a baby is on the phone to find out the sex of the baby. Or D, a researcher from an institutionally approved research study reviews the medical record of a patient. Your 5 seconds starts now. Time's up, nurses. What is your answer? Perfect. Letter C. The father of a woman who just delivered a baby is on the phone to find out the sex of the baby. Bakit? The nurse has no idea who the person is on the phone and therefore may not share the information even if the patient gives permission. Malinaw yon? Malinaw. Alright. Number 5. A 17-year-old married client is scheduled for surgery. The nurse taking care of the client realizes that consent has not been signed after preoperative medications were given. What should the nurse do? Tandaan mo yung age ng pasyente mo. Anong gagawin mo kapag hindi pa pala na-sign ang pre-op consent ng pasyente mo? 17 years old to. Ikaw, anong gagawin mo as a nurse? Is it A, call the surgeon? Galing. Is it B? Yes. Oh, yes. Napaganda talaga ako. Is it B, ask the spouse to sign the consent? Is it C, obtain a consent from the client as soon as possible? Is it D, get a verbal consent from the parents of the client? Ang galing-galing, mom. Your 5 seconds starts now. Time's up. What is the answer? Oh, kalain mo. Call the surgeon. Letter A. The priority is to let the surgeon know, who in turn may ask the husband to sign the consent. Yes, inform the surgeon. Kasi nga, surgeon dapat ang nag-explain ng surgery sa pasyente, okay? Ngayon, kung hindi niya pa pala na-explain to, dapat gawin niya yung trabaho niya as a surgeon to secure consent. What your role in this type of situation, nurses, is to make sure that everything on in terms of consent, in terms of pre-op meds are taken care of, at kung may mga na-miss, i-inform ang doktor. Board exam type of question number 6. A 12-year-old client is admitted to the hospital. The physician ordered Dilantine to the client and administering IV phenytoin or Dilantine to a child. The nurse would be most correct in mixing it with. Saan mo? Ang tanong ganito lang. Anong IV solution mo pwedeng i-mix ang Dilantine period? Ang phenytoin. Is it A, normal saline? Is it B, heparinized normal saline? Is it C, 5% dextrose in water? Or D, lactated ringer solution? Your 5 seconds starts now. Time's up, nurses. The answer is, now I kind of give this one away. Letter A, normal saline. Bakit? If phenytoin or dilantin, which is the brand name, can cause venous irritation due to its alkalinity. Therefore, it should be mixed with normal saline. Period. Alright, malapit-lapit na tayo. Kumusta ang mga score nyo? Marami-rami na ba? Ito na, nakakarami na ba kayo? Nag-grasp nyo ba fully ang ating rationalization? Okay, so board exam type of question number 7. The nurse is caring to a client who is hypotensive. Following a large hematemesis. Again, following a large hematemesis, how should the nurse position the client? Positioning nurses. Knowing na ang pasyente mo is hypotensive, paano may posisyon ng pasyente mo? Is it A, feet and legs elevated 20 degrees, trunk horizontal, head on small pillow? Is it B, low Fowlers with knees gauged at 30 degrees? Or C, supine with the head turned to the left? Is it D, bed slopped at a 45-degree angle with the head lowest lowest and the legs highest? Isip-isip, your 5 seconds starts now. Alright, your time's up. Your time's up. Your 5 second is over. So what is the answer to this? The answer is letter A. Ano to? Parang modified Trendelenburg. Remember kapag hypotensive? Alam ko may ibang mga articles or studies na hindi na ina-advise yung Trendelenburg, but this is just how you're gonna do it in a modified way, okay? Yes. Why is this? The answer, nurses. This position increases venous return, improves cardiac volume, and promotes adequate ventilation and cerebral perfusion. That's why you will ask your patient, and you will put your patient in a position like feet and legs elevated, 20 degrees, trunk horizontal, head on small pillow. Handa ka na mag-proceed? Handa na. Eto na. Board exam type of question number 8. The client is brought to the emergency department after a serious accident. What would be the initial nursing action of the nurse to the client? Anong key term mo? Initial nursing action mo after after ng serious car accident. Upon receiving the patient sa ER. Anong initial nursing action? Pag sinabi initial, what is the very first thing that you need to do? Period. Is it A, assess the level of consciousness and circulation? Is it D, check respiration, circulation, and neurologic response? Is it C, align the spine, check pupils, check for hemorrhage? Or D, check respiration, stabilize spine, check circulation? Remember the nature of accident, or the nature of the situation? Accident. You can think about it as car accident, vehicular accident. MVA, motor vehicular accident. So your 5 seconds starts now. Sorry, bigla ako na hinikab. Anong tawag doon? Parang nagla akong ano yun? Kalimutan ko na yun. Yon. Paano ba yun sa ano? Basta yun. Okay, what is the answer to this question, nurses? It's letter D. Perfect. Check respiration, stabilize spine, check circulation. I know na from the option itself, lahat sila assessment. So ito ang very tricky sa mga choices sa board exam. So kahit mga lahat sila tama. Parang, syempre alam mo na pag sinabing initial, mag-a-assess ako. Boink. Pagkatingin mo sa lahat ng options, lahat sila assessment. Ano ang tamang sagot pag gano'n ang sitwasyon? Ang sagot dito sa tanong na ito is letter D. Check respiration, stabilization spine, or stabilize spine, check circulation. Bakit? Checking the airway would be a priority and a neck injury should be suspected. Kaya, pasok ang stabilization of the spine. Sa mga umattend ng training ng EMT course, pinasok nila ito manual stabilization of spine at applying yung C-collar as part of the initial intervention mo sa mga pasyenteng suspected for what? Spinal injury. Sa mga fall or unwitnessed accident. Kasi nga, you need to suspect spinal injury. So, one way of doing that is what? Manual spinal stabilization and application of C-collar. Ayan na tayo. Okay, board exam type of question number 9. A nurse is assigned to care to a client with Parkinson's disease. What's the condition or what's the scenario? Parkinson's disease, si pasyente. Not si pasyente, but diagnosed siya with Parkinson's disease. What interventions are important if the nurse wants to improve nutrition and promote effective swallowing of the client? Alam naman natin na kapag Parkinson's disease, merong weakness. Merong weakness. Nag-create na ata ako ng lecture about Parkinson's disease at myasthenia gravis if I'm not mistaken. I-check ba lang medical surgical nursing ko? Ano pala yung teacher ko? Guillain-Barré. Sorry. Ewan ko kung nag-create na ako ng Parkinson's. Pero kung hindi pa mag-create tayo, ha? Ano to? Na-confuse ako, girl. Ang dami ko na kasing lecture na ginawa. Ma'am, minsan, pasensya na kayo. Hindi ko na mabalikan. Kayo na lang bahalang. Basta nakalagay sila sa playlist sa channel ko. Panoorin nyo, bulat-latin nyo. Para kayo nakikinig ng podcast. Ganon, ha? O ng libro. Kaso may visual, tsaka may boses ko. Perfect. Now, what intervention daw? Ito tanong, anong intervention ang gagawin mo kapag ang intention mo is your main goal is to improve what? Nutrition and promote effective swallowing? Is it A, eat solid food? Is it B, give liquids with meals? Is it C, feed the client? Or D, sit in an upright position to eat? Your 5 seconds starts now. Alright, time's up, nurses. Medyo matagal-tagal yun. Binigyan talaga kita ng pagkakataon para makapag-contemplate. Charing. What is the answer? It's letter D. Sit in an upright position to eat. Client with Parkinson's disease are at high risk of what? Aspiration and undernutrition. Sitting upright promotes more effective swallowing. Bakit nga? Kasi may body weakness ang ating Parkinson's disease. Ngayon, huwag ka mag-alala. Alam ko, I'm pretty sure hindi pa ako nakakagawa ng lecture about sa Parkinson's disease. Gawa natin to siya, baby. Okay? Alright. Nako, last 6 questions na tayo, nurses. Board exam type of question number 10. During tracheal suctioning, the nurse should implement safety measures. Which of the following should the nurse implement? Anong sitwasyon mo? Suctioning. Tracheal suctioning. Anong gagawin mo to promote safety? Is it A, limit suction pressure to 150 to 180 millimeters of mercury? Is it B, suction for 15 to 20 seconds? Is it C, wear eye goggles? Or D, remove the inner cannula? Alright, anong tanong mo? Safety measures. That's the keyword. Your 5 seconds starts now. Time's up, nurses. The answer to this question is letter what? Letter C, wear eye goggles. Bakit? It is important to protect the registered nurse eyes from the possible contamination of cough-up secretions. Lahat ito actually ay more on ginagawa mo before you do suctioning. Yung limitations ng pressure, yung duration, yung pagre-remove ng inner cannula, that's all part of suctioning consideration. But when you talk about safety measures, safety, wearing of proper PPEs ang hinahanap mo dito. Okay? Alright. So, board exam type of question number 11. The nurse is conducting a discharge instructions to a client diagnosed with what? Diabetes. What sign of hypoglycemia? Hypoglycemia, sign daw ng hypogly, should be taught to a client. Is it A, warm, flushed skin? Is it B, hunger and thirst? Is it C, increased urinary output? Or D, palpitation and weakness? Your 5 seconds starts now. Time's up, nurses. The answer to this question is letter D, palpitation and weakness. Why? There has been too little food or too much insulin. Glucose levels can be markedly decreased, less than what? 50 milligrams per deciliter. Severe hypoglycemia may be fatal if not detected. This is the initial the initial sign of hypogly, palpitation and weakness. Pangihina at pagpapalpitate. Ano ba yung pagpapalpitate sa Tagalog? Hindi ko rin alam. Comment down below. Alright. Board exam type of question number 12. A client admitted to the hospital and diagnosed with Addison's disease. What would be the appropriate nursing action to the to the client? Is it A, administering insulin replacement therapy? Is it B, providing a low sodium diet? C, restricting fluids to 150,000 ml per day? Or 150,000, 1,500 ml per day. My gosh, my numbers. Is it D, reducing physical and emotional stress? Your 5 seconds starts now. Time's up, nurses. The answer to this question is letter D. Because the client's ability to react to stress is decreased, maintaining a quiet environment becomes a nursing priority. Dehydration is a common problem in Addison's disease, so close observation of the client's hydration level is crucial. Now, I hope that this visual actually helped you with, remembering the concept of your Addison's disease. If you want to take a screenshot, you may do so. Alright, board exam type of question number 13. The nurse is to perform tracheal suctioning. During tracheal suctioning, which nursing action is essential, suctioning na naman to prevent hypoxemia? Ano ang pinakagagawin, anong ang nursing intervention mo dito ang magpapakita ng prevention of hypoxemia? That's the question. Is it A, auscultating the lungs to determine the baseline data to assess the effectiveness of suctioning? Auscultation ba? Is it B, removing oral and nasal secretions? Is it C, encouraging the patient to deep breath and cough to facilitate removal of upper airway secretions? Gigigil ako sa'yo. Is it D, administering 100% oxygen to reduce the effects of airway obstruction during suctioning? Your 5 seconds starts now. Time's up, nurses. What is the answer? Bingo. Letter D. Administering 100% oxygen to reduce the effects of airway obstruction during suctioning. Ano ibig sabihin nito? Itong administering 100%. In other terms, pre-oxygenating the client prior of applying suctioning. Bakit? Kasi kapag nagsasuction ka, hindi ka lang naman nagsasuction ng secretions, hindi ba? Sinasuction mo rin ang kanyang oxygen. So, pre-oxygenation. Now, pre-suctioning and post-suctioning ventilation with 100% oxygen is important. Remember pre-suctioning and post-suctioning is important. Ventilation of 100% is important to the client to reduce hypoxemia, which occurs when the flow of gases in the airway is obstructed by the suctioning catheter. Suctioning catheter. Alright, malinaw yon? Malinaw. Last 2 questions na, make it count. Board exam type of question number 14. An infant is admitted and diagnosed with pneumonia and suspicious looking red marks on the swollen face resembling a handprint. Parang ganito. Ito. The nurse does further assessment to the client. How would the nurse document the finding? Paano mo siya i-document as a nurse? A, facial edema with ecchymosis and handprint mark, crackles, and wheezes. B, facial edema with red marks, crackles in the lungs. C, facial edema with ecchymosis that looks like a handprint. D, red bruise mark and ecchymosis on the face. Your 5 seconds starts now. Time's up, nurses. What is your answer? The answer is letter B. Facial edema with red marks, crackles in the lungs. This is an example of objective data of both pulmonary status and direct observation on the skin by the nurse. You don't want to use that looks like a handprint because clearly you subjectify what you see. You want to be as objective as you as a nurse. You want to avoid your judgment to it. Just be objective on whatever you see. Document it the way the science and clinical presentation of your patient is presented to you. Alright, so last question na tayo. Board exam type of question number 15. On the evening shift, the triage nurse evaluates several clients who were brought to the emergency department, which in the following clients should receive highest priority? Nursing prioritization ang tanong, alin dito ang ipaprioritize mo? Is it A, is it A, an elderly woman complaining of a loss of appetite and fatigue for the past week? B, a football player limping and complaining of pain and swelling in the right ankle? Is it C, a 50-year-old man, a diaphoretic, and complaining of severe chest pain radiating to his jaw? Or D, a mother with a 15-year-old boy who says her son has been complaining of nausea and vomiting and vomited once since noon? What is your answer, nurses? Your 5 seconds starts now. Time's up. What is the answer to this question? It is letter C. A 50-year-old man, diaphoretic and complaining of severe chest pain and radiating to his jaw. Why? These are likely signs of acute myocardial infarction, MI. Nalala nyo yon? Yung characteristics ng pain ng MI. Plus the age of the client here. 50 years old, vulnerable to such condition. An acute MI is a cardiovascular emergency requiring immediate attention. Acute MI is potentially fatal if not treated immediately. That's why the answer is letter C. Alright nurses, tapos na nga tayo sa ating video discussion for today. I hope nag-enjoy ka at nasiyahan ka at may natutunan ka. Thank you so much for watching, listening, and answering these questions for me. Let me know if you have other nursing topics that you want me to do for you. Comment it down below. Please naman. Please like, share, and subscribe to my channel for more nursing educational videos. At abangan nyo po yung mga next nursing videos na i-upload ko in the future. Okay? So, grabe ang pagsuporta niyo sa channel ko. Palago na tayo ng palago. Malapit na tayo sa 10K. Oh my God! Nakalagay po yung score niyo sa baba. I'll be more than happy to evaluate your scores at gusto ko lang talaga malaman kung ano yung, kung nagigets nyo ba or effective ba yung aking video presentation, itong lecture natin. Maraming salamat po from the bottom of my heart. None of this will happen if it wasn't because of you. Thank you so much for supporting and believing in me. Again, gusto ko kayong inayahan na i-follow nyo ako sa other mga social media accounts ko. Everything is at Neil Gave except for my TikTok account, which is Neil Gave Official. What else? Also follow my Facebook page. It's Neil Gave. Nag-upload din ako doon ng mga lectures ko and anything about the nursing and about my personal self. Nag-upload ako doon ng mga entertaining contents too. So, yun lang. Maraming salamat po. Help me out, spread the news about my channel. Pamalita mo na sa radyong sira ang pinakabago, pinaka-fresh at ang pinakalibreng nursing review center sa balat ng YouTube. And I'll see you again next time.
Thank you so much, you guys, for watching. I hope you learned something.
Help me grow my channel. You already here. You might as well subscribe. #TeamKulta.
Give this video a big thumbs up and share with your friends. Let me know what you guys think. You put them down in the comment section below. Also, I would like to know your scores. Let me know on the comment section below. No shame on this channel, okay? Put your scores. Be proud. Pinaghirapan mo yan. Also, don't forget to check out the other playlists I created for you. I'll be putting the links on the description box, or simply click this icon button right here. Let's connect. Follow me on all my other social media accounts. Everything is at Neil Gave except for my TikTok account, which is Neil Gave Official. I would also like to encourage you to please follow, share, and like my Facebook page. It's Neil Gave. I'll see you guys there.